Hello, this is Dr. Bob DeMaria with Dr. Anthony and Dr. Casen DeMaria. And today we have one of the most exciting programs that I've ever been blessed to present. We're going to talk about the mechanics of the spine. I know that right now 126 million Americans have pain. I know one of the leading causes of people to miss work is back pain, followed by headaches. Well, we are the masters of figuring out what's causing spinal dysfunction. And I have been so fortunate that Dr. Anthony and Dr. Casen have joined up with me at North Coast Chiropractic. You see, I have a degree in spinal engineering. We take this very serious, and I've been involved in natural drugless chiropractic care since 1978. Well, they brought a whole nother level of excellence to our practice. So if you're suffering with pain, if you've already been to a chiropractor or an osteopath or orthopedic surgeon, or have already had your spine operated on, you have rods and screws in your spine, you need to stop by our office. If you have a friend or a relative and you're watching this program right now, we see people all the time that have had spinal surgery. So we have an array of items in front of us right now. And what I'd like to just share with you, and then I'm going to turn this over to Dr. Anthony and let him explain to you one of the techniques that we use. This is a cervical spine or a neck. Now I'm going to share something with you. Your neck has everything to do with your low back. And what we're seeing more and more in our practice, that chronic low back problems are a direct result of misalignment, subluxated vertebrae in your spine. And see, as chiropractors, especially the kind of chiropractic that we practice in our practice, if your spine is out of alignment, it's going to put pressure on sensitive nerves. And not only do you have the potential to have neck and back pain, but you could have sinus problems, asthma, heart, colon, because your nervous system controls the function of your body. So Dr. Anthony is going to pick up the spine right there, and I am just going to turn it over to him and let him start talking. It's all yours, Dr. Anthony.
Well, as Dr. Bob had mentioned, this is your spine. This is what is actually inside your body. And a lot of times we have patients that are talking to us about different things that are going on in their body, and some of the most critical things is understanding how proper mechanics affect your spine. So someone might say, well, I have knee pain or I have ankle pain. Do you think that that is affected from my low back? And of course, that is true, because when you look down here, the nerves that come out of each of these levels go down your legs to your knees and your feet. So if these are not in the proper alignment, that can cause dysfunction in other parts of your body. And when they're not in alignment, that's called a subluxation. So you can say, a sublux what? Well, subluxation is when those bones are out of alignment, causing interference of the brain's ability to communicate with the body. And that might be a little crazy to some people, but your brain controls everything in your body. So, and how it gets its messages to the body is through the nervous system. So that's why we're so passionate about chiropractic and the spine, because of the nervous system. If you don't have your control system working properly, it can cause all sorts of problems. So one of the great things we do in the office is we really are checking the curves in the spine to see if they're in the proper shape that they should be. And what we've seen lately is we've seen a lot of people aren't in the correct alignment that they should be.
So we take some special x-rays. Do you want to talk about how we do? Do you want to use this, Dr. Casen, the flexion extension?
Sure.
And what that means, and then we can talk a little bit more about what we're looking for.
So what we do in the office actually is we're doing motion x-rays. So we're able to actually see what exactly is moving in the spine and what is not moving in the spine. So the first x-ray we do is the flexion x-ray. So you actually tuck your chin, and what you're supposed to see is all of the vertebrae should go evenly and spread apart. And a lot of times what we're finding is maybe especially the lower segments, you see them not opening as they should. They're actually stuck together. So that's definitely an indication of a subluxation in an area that we need to focus on because there is no motion in that x-ray.
What could cause them to get stuck? You know, like people say, well, I wonder if mine's stuck or not. What can cause? We had someone the other day said, how did this happen to me? Remember her when she came into the office? So what can happen?
Definitely from birth, the first bone that subluxates is the atlas. So even by this not moving, it can, if anyone has any motor vehicle accidents, slips, falls, traumas, anything like that.
Football.
Soccer, like you said earlier this week, cheerleaders, people who horseback ride, they have the worst pelvises, I think.
Yeah, horseback riders.
Just because
and people love to ride their horses.
Right, and then the second x-ray that we do is an extension x-ray. So as you can see here, all of these are supposed to close down on each other evenly. And we're finding a lot of people, they have an occiput, which is the top bone. It doesn't go as close to the atlas as it should. And a lot of people with this kind of subluxation have chronic migraines, headaches, a lot of pressure. They could even be having neurological symptoms like tingling and numbness into the fingers, down the arms, which they might not think is due to their neck. They could think just something's wrong with their hands. But we're finding that a lot of people are subluxated in their upper cervical, which can have problems down the road with migraines.
So we know that this is definitely an issue. Now, I learned something from Dr. Anthony and Dr. Casen. You can see, Dr. Bob, you learned something. I learned something every day. And what I have Dr. Anthony talk about now, would you want to use maybe this decay model and talk about how the lumbar vertebra rotate and explain that, or would you rather use that model?
I'm going to use the large model because it's really a foundational model. So everybody knows that having a good foundation is important. So it's just like your low back and your pelvis, and this is a shot from behind, why that's important. So we're going to say this bottom bone here in your low back is called the sacrum. So if these bones are out of the proper position, what will happen is that those vertebrae start to shift in different directions, especially the lowest vertebra. So if they shifted, it's because this bottom bone is out of position or subluxated. So if these bottom two lumbar vertebra rotate, then we know that it was from the pelvis. And if it starts rotating above here, it's from the neck. And you say, oh my gosh, my low back is from the neck? Well, yes. It all has to do with proper mechanics because your brain weighs about 10, or your brain and your skull weigh about 10 pounds, and gravity never takes a vacation. So if you don't have the proper mechanics in your neck, it can throw off all of the curves in your spine and throw off your low back. And that is phenomenal to have that information said to everybody.
And I know that this is an example of the pelvis, and there's a bone in here called the sacrum. So when somebody comes into our office, we take what we call an AP pelvis view, and then what we're looking at is we're actually looking at the position of the pelvis. But if you look really close right here, we're looking at these holes. So you could come into the office, and if your pelvis is twisted like this, it actually appears like one hole may be bigger or smaller than the other. Well, in essence, they're not. But because of the function of the spine, and you could have that misalignment that's going on in there, that can actually cause a lot of bladder challenges, can cause bowel challenges inside of our patients when they come into the office, and their nervous system is not going to function optimally. Now, we're going together as a group show you something that we're doing in the office right now, and it has been amazing what's happening. So we have in front of us, we have a graph of different vertebra and x-rays, okay? So what we're looking at right here is this is the side view. This is a normal neck right here. We had an individual that recently came into our office, and this is not uncommon, where you can see that this person's neck is very forward. And what's happening, and I'm going to have Dr. Anthony grab that vice grip right there. If you look really close to where my finger is at, right here like that, that person's spinal cord is getting choked, just like that vice grip is putting pressure on that nerve or that wire. So I want you to think of your spinal cord. Now this particular person's MRI, they had carpal tunnel surgery twice to both wrists. And they were going to actually do a carpal tunnel surgery the third time. And then right over where Dr. Anthony's at, he's going to show you with this finger, we have the red hot and we have the blue. Do you want to explain to them what's going on with that particular thermography? Now, this is a temperature picture. This is high-end CSI technology that we're doing in our practice right now.
Well, what's really great about the thermography is a great educational tool as well as a clinical tool that we use to tell us when to adjust a patient, because what we would really ideally like to see in this graph is for this to be all either light blue or yellow. And if it was light blue or yellow, these lines would be straight. And you might be saying, well, why is that important? Because that lets us know that your nervous system is functioning from your brain to the rest of your body is correct. And as you can see in this person, we like to call this a choking or a death scan. And you say a death scan, that's pretty harsh. The death scan is indicating that the brain is not communicating as properly as it could with the body, and this person is not living as optimally as they could be. But one of the great things is in our office, we change these scans every day.
Well, you know, before we put this down, I think we can wrap our brains on this because we just proved with technology. I mean, that MRI, that's not lying. That MRI is showing that spinal cord is being choked. She had carpal tunnel surgery. Can you imagine that? Twice to both wrists. So that scan is an example of what we do. So if you are suffering with any kind of body dysfunction at all, I'm going to ask you right now, you need to come into our office and be checked. You say, why am I going to do that for? Well, your brain is sending 28 billion messages every day. So it's going from the brain cell to the tissue cell, and your nervous system needs to function optimally. And if it's not functioning optimally, you're going to have a lower state of health. We're going to take a short break, and we're going to be right back. Hello, this is Dr. Bob, Dr. Anthony, and Dr. Casen DeMaria, and we are taking you through a voyage on how to understand the spine. I feel like I'm at a scientific study laboratory right now, and I'm going to turn this over to Dr. Anthony because he's going to talk about the curves in the spine. Dr. Anthony.
I think one of the things that people don't ever learn at its knowledge, if you could just open up a Gray's Anatomy book and you'll see that there are natural curves in the spine. And the curves are important because that helps to allow the body to react to the stress of gravity that you have in everyday life. And if you don't have those proper curves, then your nervous system is not functioning at its optimal state. So you could say, Dr. Anthony, what are you holding in your hand? Well, this is what we call an AccuArc ruler. This is just one of the tools that we use to measure the curve of your neck. And this is significant because this is the normal curve of somebody's neck. And what we've been finding quite a bit is that people's necks are either straight or they're this way. We've seen a lot of this with people that do a lot of technology or read books and their heads are down all day. So it's really important that you get your neck in this position, and this is what we do all day in the office, and it makes us excited. So you could say, Dr. Anthony, who needs chiropractic care? And Dr. Casen's going to share a little bit more about that.
But before she does that, I want to show something with this. So what Dr. Anthony was showing is, this is that normal curve right here, this nice C curve like this. And then this is what's happening to these people. That's the opposite view of what's going on. And that's going to put a lot of pressure on nerves. I wanted them to see it with a spinal model too. So Dr. Casen, I'm going to turn it over to you.
Well, everyone needs chiropractic care, but specifically I think the best time to get care is when you're first born due to the traumatic birth process, which could, whether it's a C-section, the forceps, and we were just talking to someone the other day about how in the emergency room certain procedures are done that are the babies are actually hanging upside down longer than they need to be just due to the doctor's procedures. So
that's scary, isn't it?
That's very scary, and I was privileged in school to actually do a research paper, a peer-reviewed research article from Dr. Nate's Berner's office, which is a Pierce practice, but he had a 12-year-old female, and she actually had a reverse curve. So if you get that out again, your normal curve, like Dr. Anthony was showing, was 45. They like to see the 45-degree angle. So her curve actually at 12 years old was going opposite the direction it should be, and she was having constant migraines. She actually missed school for one month duration at a time, and then with just 5 visits to the Pierce chiropractor, her neck was a complete reversal in 5 visits with 0 migraines. So if that's in a 12-year-old female, you can imagine these people coming into our office in their later years who have never had chiropractic care, who have been in, could be up to 6 or 7 motor vehicle accidents, slips, falls, even when their baby's falling and they don't even know what their spines look like. So we've been seeing more commonly than we thought we would, actually, being in school and everything, that people's curves, they actually have no curve in their neck.
It's kind of scary. And I know that we just did a program on a local TV station called Techno Neck, and this is just an example of what Dr. Casen was talking about. This happened to be that adult that came in where you could literally see that that curve is going in that opposite direction, and it literally puts pressure on nerve. And I think the technology that we're using today, if you look there at that screen, it's scary. And you know, what's happening in our society is that people don't realize that kids can have subluxation. So we have children that come in and have asthma. We have this one little boy right now that's on 14 different medications. To me, that's malpractice. There's no reason that any child should be on 14 medications. Frightening, isn't it? What I'm holding in my hand right now, so we've gone through a progression, is this is a model of decay. You say, what do you mean decay? Well, what's very interesting about the human body, as you mature and get older, you actually have less pain, but you have decay. I'll say that again. You could come into our office and have no pain at all. We could show you your films, and you have massive decay. You may be wetting your pants. You may have some challenges with erectile dysfunction, constipation, asthma, headaches, all kinds of body signals. We take films of your spine, and if you look at this from the side view, this is normal. This is a phase 1, this is a phase 2, and this is a phase 3. Now what happens to individuals is over time, with trauma and injuries, this disc space actually gets narrow. But with the type of techniques that we use in our office, are skilled specific adjustments, and one of the names for that is called the result system. You want to know why it's called the result system? Hello, we get results. So what we know is that once we improve function, now listen, I'm going to word this to you. We don't fix discs. We improve function, and the disc will help heal itself. Now, if you have a herniated disc and you've been smoking and you're overweight and you've been eating a lot of sugar, those are all body habits that you do that depress and decrease function of the spine. It's going to slow our healing process down. People who smoke always heal slower. People who eat sugar have pain. And I know that people don't like it when Dr. Bob tells them that sugar could be a part of their own problem that they have. So this is a phase 1. Here's a phase 2. Phase 2 is decreased disc space with spurring. Phase 3 is that disc space and bone are nearly touching. This person could have pain, as Dr. Anthony was saying, going down into their legs. So when you come into our office, we have specially designed tables that are very specific for us to help improve function, painless. Now, if you eat a lot of sugar and dairy, you may have some discomfort. If you squeeze your wrist right now and it is swollen and inflamed, we know that your body has inflammation. But we have had people that have been on this program before that have had pain for 20, 30, and 40 years. And if we can take the time and take these specific x-rays, we take our films standing up, because you don't go through life lying down. We take our films standing up. We use mechanical motion to take those films, and Dr. Anthony, myself, and Dr. Casen have been specifically trained, not necessarily as traditional chiropractic has been trained. I'd like to call what we're doing is that we are specific adjusters. It's like a tomahawk missile, right to the point. We're lasering right in there. Why do you think we're doing those CSI type of thermography scans? We're doing those scans because your body is telling us when and what not to adjust. And Dr. Anthony, Dr. Casen, I know we have so many models right here, and I want to make sure, is there anything else that you feel is going to be so important for our audience to hear? Do you have any comments, Dr. Anthony, about how about even our adjustments themselves?
Well, I think that one of the great things about the system is that with specific adjustments, you can really receive wonderful results in the office. And we're not here to scare you or tell you what you're doing is wrong. We're just really passionate about helping people through chiropractic care and allowing their bodies to heal themselves. So if you can just get that one little nugget from what we talked about today, that's just so vitally important to understand. And so Dr. Casen and I, when we've been doing some of these exams and consults on patients, we had a guy recently who told us, you know, if I would have known I was going to live this long, I would have taken much better care of myself.
I think that's a good point. That's kind of frightening, isn't it?
That's crazy.
So, Dr. Casen, what about, because I know you love treating kids, and I think we need to, by the short time we have left, kids in chiropractic. That's like a wow for people.
I know. I think it's my favorite thing too, because actually just yesterday listening to Dr. Pierce in a seminar, there's only a small amount of chiropractors that get beyond the symptoms, like the percentage, and we're part of that percentage because we're actually focusing on correcting your spine. And we know exactly when, how, and where just by using the analysis of the Pierce result systems. And I think that's so important with kids because if kids' spines are getting corrected at a young age, imagine all the things that's going to help stop them from, especially like depression, even ADHD, ADD, even sleeping through the night. I know with a patient yesterday, she's waking up all hours of the night and they own a shop and her kid's not sleeping. And I know that with someone who works in our office, she says that they sleep the best after they get adjusted. So even just that tool of sleeping better through the night, ear infections, coughs, anything like that, but it's beyond that.
That is so good, and we are so fortunate because we have the latest technology that's out there. And a lot of times we correlate, and people associate what Dr. Bob does with diet. What I need you to wrap your brain around is this fact. What you eat can create pain and dysfunction. Sugar can cause pain. Dairy can cause pain. So we really want to focus on the food aspect of what's going on when you get into the program of care, because we know that that's a part of what's going on and causing dysfunction. We'll use traction in our office. We also make that traction available to you to use at home. We have specific therapeutic exercises that we do for our patients, or we have our patients engaged. Because see, this is not about Dr. Anthony and Dr. Casen and Dr. Bob getting the patients well. What we are doing is that we're empowering our patients to make wise choices. We're giving them educated information so they'll know exactly what to do and when to do. And so we go through a series of adjustments. We're going to do a recheck. So why you can do a recheck? We want to see how your body is progressing. So we'll take some films over. We'll use minimal exposure time. And then we'll go through a series of other adjustments and maybe more specific adjustments to find out exactly how we can improve your spine and your function. And then at the end of that time, everybody should be checked periodically. Because sometimes the hardest point for people to wrap their brain around is, well, if you go to the chiropractor, why do you have to go back for it? Well, Dr. Anthony made a comment at the beginning of the program. Gravity never takes a vacation. Have you ever thought about stopping your medication? No, because your healthcare provider told you to take your medication. Well, wouldn't it be wonderful if you could engage in life, make appropriate and necessary lifestyle changes, and with the permission and the work of your prescribing healthcare provider, make that wise choice to get off of those bad effects from those drugs? Because see, a lot of people, when you mention to them, hey, if you're taking that antidepressant, which is a drug, in their own mind, they can't see it as a drug. They think of it as a medicine. Well, all drugs have bad effects.